Good afternoon, everybody. Trying to just send out a presidential message. I know that there's a lot of things going on that we're all seeing, and it's quite a few weeks of just craziness. There's a lot of angst in the community, and yet we still have to just sit back and relax and look at some of the things as we face some of these challenges. I know that although hospitals are struggling, we all know that we're seeing occasional, not global, occasional cancellations, and certainly cancellations of surgeries will affect income, follow-ups, as well as new patients, just for the fact of the fear that they have as it's permeating society. I look at this two different ways. On one hand, we've got an incredible amount of added time that we otherwise didn't have, and in an office setting, that's waste, and I hate waste. I hate duplication of anything. But at the same time, I look at this from a personal standpoint as an opportunity to get some time to do something that I haven't had a chance, that actually plays a particular role in how we're going to face maintaining our practice here in Indiana. And I think it's probably something that could benefit people elsewhere. Just when it comes to steps in the office, I think it's absolutely funny how hand washing should be a standard, right? We should all be hand washing. What I see is this is an absolute top of mind thing everywhere in my practice. Sanitizing surfaces, etc. I mean, it's just everywhere. And so that's going to be a positive that comes out of this on the other end, is that we're going to be building practices that we should have had all along, but we, just maybe took for granted or at least I was not as aware of what my staff was doing in this regard until just recently. The other thing that's been a real challenge for me is this avoiding of handshaking. I'm a handshaker. That's all there is to it. The idea of a fist pump or giving somebody an elbow in a essence to gain that connection is just not natural for me, and so it's going to take some getting used to. I can tell you that every one of my Medicare beneficiaries, this is top of mind. They recognize they're in a higher risk group, and so when they come in, hey, they're happy. But you know what? Nobody wants to shake. Nobody wants to shake hands right now. So it's an interesting dynamic, wouldn't you say, that we're facing in our practice, and it's certainly something that we have to adjust with. I've got more hand sanitizer through my office than I ever knew we had, and for whatever reason, I thought it was wasteful for us to have these monster containers of hand sanitizer, and I now can't get it if I wanted to. So I think we've got plenty of hand sanitizer to get us through this crunch. At the same time, it's just amazing how that has been top of mind for everybody. Now, when it comes to our schedule, we're trying to be proactive, as I'm sure all of you are. Any patient that we have that has a non-procedure visit, meaning they're coming in without need for an ultrasound or a procedure, we are working to reschedule them, or better yet, introduce them to telemedicine. Some guidance has come forward with telemedicine that is going to help us, I think, as we move through this era. On the schedule side, by contacting everybody that didn't pre-check through an app that we have, it allows you to assess the health of the schedule, the health of the patient, so you don't have people coming in sick. And I just think it's a best practice, okay? And now we're looking the next 2 weeks in advance for those patients that have no surgery or ultrasound scheduled, so that we can actually get them an opportunity to do a telemedicine visit. Now, when it comes to telemedicine, I think this is something that really we should all pay attention to and try to get some understanding. It took a national emergency for this to actually get attention by the payers, and now I've got information from Anthem, United Healthcare, as well as Medicare, which are my three big payers, on how they'll approach telemedicine. There is a website. I'm going to give you the address here. It's cms.gov/newsroom/fact-sheets/telemedicine-health-care-provider-fact-sheet. This came out March 17th, I believe, is the recipe for us to monetize telemedicine for what is actually the highest risk group if exposed to the coronavirus. We have made a lot of progress with the Cure for You app that we've used is a third-party app that's integrated with our EMR, or our practice management system known as Athena Health. And we now have templates for new patients for telehealth as well as for established patients. But we're actually going to implement this as of Monday, and we've contacted all these patients. I've done a handful of telemedicine cases in the past, and to give you a snapshot, these things have been fun. They have been free historically because we didn't understand the proper billing procedures. And again, that's something that takes a little homework for your payers in your market to sort out. But I think we're getting a good handle on it, what we're going to have to do in Indiana. But when it's all said and done, each one of these encounters has been an absolute joy. They take very little time. You can focus on exactly what the patient needs. If you are doing the visit incorporating an app, you also get a chance to assess the patient's symptoms, verify X, Y, or Z. And because it's on I say iPhone, but it could be on any smartphone or tablet, you get a chance to actually inspect the lower extremities. You won't be able to put your fingers on them. You won't be able to assess the extent of pathology, for instance, on an ultrasound, but maybe it's discussing thrombophilia testing. Maybe it's discussing, a patient that would otherwise come in for just a routine follow-up months after treatment just to make sure they're going the right direction. A patient that's had a prior thrombosis, but you're not planning to do an intervention, but make sure that they're going the right direction. Address any questions that they have. I believe telemedicine knowledge that we're going to gain in this crisis will help us all in the future. And I think if you can take some of this time that we're seeing that we may have and spend a little opportunity reaching out to your carrier representatives if you have that contact and trying to get some answers, that you'll ultimately end up on the other side more efficient and able to actually monetize these visits in a very meaningful way. I don't think it substitutes being in the office, but I can tell you from the first few of these telemedicines that I've done that have been patients, if you will, a free consult, every one of them has come in and had treatment. So it is a way to connect with somebody, realize that you're a nice person or a nice team of people, and ultimately it will likely pay dividends in the long run. I want to touch base on October. If you're aware of many CME events, I mean, they've been canceled across the board. SIR was canceled. The New York Vein Symposium was canceled. Now, these have likely been rescheduled. Our event in October in Washington, D.C., right before the election, is going to be an exciting time to be in D.C., if I might say. I think it's going to be a wonderful opportunity, and we should be on the downhill side of the COVID-19. Now, I don't take that for granted, but I can tell you that registration is being opened right now, and we've got our early bird special. So if in fact you're planning on attending a conference this year, or you missed out on an opportunity and you're still looking for those CME hours, I would make it an opportunity to come to DC in what should be one of the more exciting places to be in October. There are a number of other things that are happening in this society that I want to keep everybody abreast to. I mean, everybody's familiar with the advocacy efforts that we have been working on, and that's actually a small army of active people that are addressing a variety of topics, but they all focus on access to care, payer policy, and payer relations. So these are all important facets of what we're doing in advocacy, and we are making strides. On April 7th, I think it's important that all of our members know that 3 of our board members have selected as subject matter experts for a joint CAC meeting with First Coast and Novitas, the 2 largest MACs. All of the other Medicare administrators follow the lead from these medical directors. I can tell you from personal conversations that I've had with these medical directors, they're tired of talking about varicose vein policy. They're looking for something that makes sense, something that actually is going to give their patients that need the access to care with the treatments that they need. This is going to be run similar to a MedCAC meeting that was back in 2017. But the reality is, I think that we may actually make some strides. I know that the attention has been on curbing utilization, and yet attention has certainly been brought to bear that venous leg ulcers are largely being ignored, and they're not getting the care that they need. And to think about the $15 to $24 billion worth of resources that are used to manage chronic wounds, 15 billion of which is leg ulcers, I think it's reasonable to ask for the 155 million in expenditure every year in vein care to go up to maybe 300 million, with an understanding that we would probably cut the 15 billion down to less than 10. It's crazy how patients with venous leg ulcers in some communities are stuck in wound centers, scrape, 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 scrape. And then we do get them in a year, and they're still open, and it's a tragedy. Okay, so this is something that has been conveyed to these medical directors, and we are certainly hoping to bring further light to this. There is no magic pill that we can take to change payer situations, but at the same time, when they're coming to our society as subject matter experts and people that they trust to help give them an honest answer on what the benefits of X, Y, or Z treatment are, I think that says a lot to what we're trying to accomplish here. And I think all of you, well, I shouldn't speak for you, but I cannot be more proud of what our society is doing to support patients and providers, as well as industry and the payers. We want a win-win-win here, and hopefully April 7th will provide that. We do have a board meeting coming up on the 23rd of March as it pertains to COVID-19. If we have other additional recommendations for you as members, by all means, we're going to reach back out and share anything on a moment's notice. Bottom line is we're going to get through this. I know that we're all undertaking some stressful times right now. We do have to look at our practice, what's best for our practice. It may be that closing our practice on a temporary basis is necessary based upon the risk to the patients. I hope that doesn't come to that, but we have to actually look at what's best for our patients, what's best for our staff, and what's best for our community. And I think if we focus on those things, we're going to get through this. There's going to be some tough times, but I think we're going to come through on a very positive end. So in closing, I want to ask you to look at this extra time that you have as a potential benefit to maybe work out how telemedicine might play a role in your practice. If you are still looking for CME, or you're still planning on coming to an annual Congress this year, take advantage of the early bird registration rates. And lastly, stay in touch with your local authorities with the COVID-19 in your market. It will help guide you one way or another. I'll see you on the other side here soon. And in the meantime, just stay positive. There's a lot of good that we can do together. Thank you.